Tiny Maisie was born in 2017. C.G. Green says that from the start, her daughter was mysteriously ill. When you brought Maisie home, what did you begin to notice?
Initially, she just sounded like she had a cold all the time. She just sounded really congested. And after, I'd say like 2 weeks, I noticed that Maisie wasn't holding her head at all. She was just like jello. Her head, neck was like jello. And her head would just flop.
C.G. had a feeling something was terribly wrong, something doctors couldn't name, until one took a blood sample to test for spinal muscular atrophy, SMA.
And she left with the blood, and she came back and she goes, "You heard me when I said we're testing for SMA." And I said, "Yes, I heard." And she goes, "Do you know what that is?" And I go, "No." She put her hand out. And I said, "Please don't touch me. Please don't touch me," because I knew everything I had been feeling. "Please don't touch me." I said, what can we do? What can you do?" And she shook her head. She said, "Love her and squeeze her."
A missing gene caused Maisie's muscles to waste away. SMA is often fatal by age 2. Then, just in time, in 2019, something like a miracle was approved by the FDA. Just one dose of a drug called Zolgensma can replace the gene to stop the disease. But the dose is $2 million. Maisie was on her state's Medicaid. The insurance company that managed Medicaid said it would not pay.
I became very angry to know that there was something that could help her. And I knew, without a shadow of a doubt, I was burying my daughter before she was 2. It was cheaper for her to die. They were banking on her dying.
Maisie's story is a view on what's coming to American healthcare, because today there are more than 300 high-cost genetic therapies in clinical trials, some for diseases suffered by millions of patients.